Are you tired of seeing more and more of your scalp through your thinning hair? Today I'm going to share my experience with Platelet Rich Plasma or PRP treatment and how it helped me. This video is about the sort of hair thinning men and women get as they age, known as androgenic alopecia, and not the scarring, patchy or inflammatory types of hair loss. Keep watching to find out why I decided to use PRP to treat my thinning scalp. If you're new here, I'm Dr. Finbar, a family doctor now specialising in dermatology. On this channel, I help you learn to love the skin you're in for more joy, health and longevity. During lockdown, I spent a lot of time in video calls, and as I typed and I looked up at the screen, I could see my scalp on the computer screen getting very obvious through my thinning hair. Now, I'm in my late 40s, and like many men, I live in a fantasy dream world where I still think I'm in my early 20s. So I thought if I ignored my hair thinning for a while, everything would be okay and it'll just grow back again. Well, that didn't work. During my late teenage years, I had long hair and I imagined embracing long hair again upon retirement. So before I lost my hair altogether, I thought it was time to start growing it now before it was too late. Firstly, the evidence shows that most of the treatments which do stop and reverse hair loss do so by increasing blood flow to the scalp. So that's what I wanted to focus on. Now, massage and microneedling are really good techniques that can help to increase that blood flow, but I wanted something a bit more potent. Second reason was I decided I didn't want to use oral drugs or prescribed treatments. Thirdly, I didn't feel that I was at the stage where a surgical hair transplant was necessary, and having treatment sooner than later would help me avoid that altogether. Fourthly, the concept of using PRP derived from my own blood without any additional medications or chemicals really appealed to me. And finally, I had access to PRP now treatment in my own practice, and as I had already seen the benefits in others and my patients, I was more than happy to get the opportunity to try it out for myself. PRP stands for Platelet Rich Plasma. Now, I like to keep my health, healing and longevity practices as natural as possible, and so I love PRP because it's a non-surgical regenerative procedure that aims to treat hair thinning and hair loss by utilising our own naturally occurring healing properties with no artificial chemicals or nasties. Here's an overview of the PR treatment process for hair thinning. Firstly, we collect blood. A small amount of the patient's blood is drawn into a special bottle designed for the purposes of turning it into PRP. Next, the blood needs to be separated into its components. The blood is placed in a centrifuge to separate these components and specifically to isolate the platelet-rich plasma from the rest of the blood. And then finally, that platelet-rich plasma is now containing a high concentration of platelets and growth factors, and it's drawn up out of the tube and injected into the areas of the scalp where the hair thinning or hair loss is evident. The growth factors in PRP are thought to promote angiogenesis. Angio relates to blood vessels, i.e. an angiogram, and genesis is taken from the Greek word meaning origin or birth. So angiogenesis is the creation of new blood vessels. I hope you're enjoying this content so far, and if so, please hit the like button and consider subscribing. PRP also promotes cell proliferation, which means a rapid increase in the number of cells, and this rapid increase in number of cells can then stimulate the growth of hair follicles and consequently new hair growth. PRP can be used all by itself or in combination with other hair loss treatments. PRP therapy is considered to be a very safe procedure as it uses the patient's own blood components, and this reduces the risk of adverse reactions. However, like any medical procedure, there can be potential complications and side effects. Some of these possible side effects with PRP may be, firstly, infection. And although this is very rare, there still is a risk of infection at the injection site. You can get pain and swelling. Some patients may experience pain and swelling or discomfort at the injection site during and following the procedure. I found that during and after my first treatment, I had very little pain or bleeding, but at the second and third treatments were increasingly tender, and I also had more blood spotting at those injection sites. Now, this is a really good sign, and it's likely due to the improvements in blood flow and sensitivity of the nerve endings as they also rejuvenate. Third complication can be bleeding and bruising. As the PRP involves giving injections, there's a possibility of minor bleeding and bruising at the injection site, and you can put a bit of cold compress on if that happens. But in practice, these complications are really rare, and in fact, PRP has been used to treat things like non-healing wounds and improved scars. I feel PRP has already improved my hair and scalp health, and I expect to see continued benefits. To date, I've had 3 treatments 1 month apart, and my last treatment was just over a month ago. Now, given my experience with the patients that we have treated in my practice, I'm still expecting improvements in my hair growth over the next few months, even with no further PRP treatments. I do feel that my hair has thickened, but in addition, like many of my patients have noticed, I find that it feels stronger and more healthy also. My hair has grown quite a lot since the first or before the first PRP, and maybe the PRP has helped with the speed of my growth. Although I do plan to have top-up treatments of PRP every 6 months, I've also started to combine it with a couple of other maintenance treatments that I find easy to do. The other things that I'm using are Ketoconazole shampoo. I use a 3 times weekly treatment of topical Ketoconazole shampoo. You massage it into your scalp to ensure that it reaches the hair follicles and leave it on for about 3 to 5 minutes before jumping into the shower and washing it off. Look for a shampoo containing at least 2% concentration. Ketoconazole is an antifungal agent, and it was initially developed to treat dandruff and psoriasis. In hair loss, ketoconazole has been proven to not only increase hair count, but also hair diameter. It disrupts the growth of fungi found in our scalps. We're all exposed to these fungi through our daily life, and that's not because of poor hygiene. Ketoconazole seems to reinforce the protective properties of our own immune system and results in a mild reduction in a hormone called dihydrotestosterone, or DHT. Now, DHT is a hormone made from testosterone and causes the follicles to shrink and weaken. So reducing and blocking DHT is a good thing when it comes to treating hair loss. The evidence shows that Ketoconazole shampoo can bring about an 80% response rate in maintaining hair that would otherwise be lost. And side effects are relatively mild and include a little bit of scalp irritation or hair thinning, ironically. This can sometimes be offset by using shampoos which contain biotin. Let's talk about red light therapy, also known as photobiomodulation. Now, I've been using a red light and infrared panel on and off for a few years in an effort to improve my recovery from triathlon training. Regarding hair loss, this systematic review and meta-analysis aimed to evaluate the effectiveness of red light therapy in treating hair loss. The researchers analysed 36 studies, including randomised control trials with a total of 966 patients. The study found that, among other advantages, photobiomodulation therapies using red and infrared light effectively treat androgenic alopecia, which is what we are focusing on in this video. I'll continue to use it based on this review's findings and its effectiveness in post-exercise recovery. In fact, I'm exploring specific devices designed for scalp application. Here's a few examples. Now, I have no affiliation with these manufacturers and I haven't purchased any of their products yet. It's worth noting that these devices can be quite costly. I already work on other lifestyle practices which may also help improve hair health, but I want to mention them now also. Being stressed, having a poor diet, or not getting enough quality sleep can lead to hormonal imbalances which may worsen hair loss. So as always, I can't recommend a healthy diet, exercising regularly, managing stress, and getting consistent sleep quality enough. Now, I was aware of its use in orthopedics for the treatment of joint problems like inflammation and arthritis, and I knew the results were promising there. But I always thought that the skin treatment was limited to vampire facelifts that celebrities use, and as I don't run an aesthetics practice, I wasn't too keen on going down that path. Well, hair thinning can be emotionally challenging for many individuals. Now, I remember being asked in my 30s, what would you do if you started going bald? And my confident response at the time was, I'll just shave it all off. Well, it's interesting now that while that solution works well for some, when I actually experienced hair thinning, my initial reaction was quite different. After a period of denial, I amusingly found myself attempting to disguise the issue with a comb-over. I feel PRP has already improved my hair and scalp health, and I expect to see continued benefits. I'm also using Ketoconazole shampoo 3 times a week and continuing to use red light therapy. To me, these feel like an effective balance of almost natural treatments. In his thorough review on YouTube, neuroscientist and Harvard professor Andrew Huberman goes into the variety of treatments for hair loss and hair thinning. Huberman's video goes into great depth on drug, mechanical and many other treatments for hair loss, and it's definitely worth a watch if hair loss affects you and if you have a couple of hours to spare. If you're considering PRP for hair thinning, it's best to consult with a qualified medical professional to discuss your specific situation and expectations. If you like this video on hair health, you'll also like this video where I discuss how we can use visualization as a tool to help us heal and improve our health and longevity goals.